I'm Angus King, United States Senator from the state of Maine. Well, there's a lot of data, but it's sort of coming from a lot of different sources. I think one of the best sources is the Kaiser Foundation, and they have a lot of information that's coming out. We are seeing a number of people getting coverage that didn't have it before, people that were excluded from coverage because of pre-existing conditions and that kind of thing. So I don't think there's much question. Kathleen Sebelius recently used the figure of 22 million. That was questioned by some sources, of 22 million people who had coverage under the Act. I think the number is probably somewhere between 16 and 22 million, but that's a lot of Americans. And I believe that you're going to see a significant increase during the next round of open season for enrollment starting this fall. Another little piece of data in Maine, our two major carriers that were on the exchange have announced their prospective rates for next year. One went up about 3%, the other one went up less than 1%, and we're going to have a third carrier on the Maine exchange. So I think the exchanges, at least from my little anecdotal perch in Maine, appear to be working in terms of providing some competitive pressure, because these, as you know, the increases on the individual market, which is what we're talking about here, over the past 10 or 15 years have averaged, well above 5%, and quite often in double digits. So I'm mildly optimistic about the course. I think more healthy people signed up than perhaps was expected, more younger people, and as you know, it's all about the risk pool. We had a nonprofit created in Maine, a co-op, and that's been very successful. They were very successful on the exchange. So, given the rockiness of the start, I think we're seeing some real progress, and people are finding that they can find care at an affordable level that I think a lot of people have been surprised by that. I think it's a whole lot of factors. Steve, that's the trillion-dollar question around here, because the Congressional Budget Office recently lowered their projection of healthcare costs to the federal government over the next 10 years by over $1 trillion because of the slowdown in the increase in healthcare costs. Everybody has their view about what's causing that. Some people say it's the recession, some people say high deductibles, some people say the Affordable Care Act. I think there are provisions in the Affordable Care Act, such as penalties on hospitals for readmissions, the creation, I know in Maine we've created several of these accountable care organizations where the providers are in effect provided incentives to do preventive care and to keep people out of the hospital. I think that's showing some results. My guess is it's a whole lot of different factors. One of my favorite observations, a friend of mine said, rarely is the solution a silver bullet, but it often can be silver buckshot.